Good afternoon, everybody. Welcome. Today is Friday, May 15th. We are glad that you are here to again get updates about COVID-19 in Eau Claire, to learn about our most recent data, and to provide updates to you on other issues. We're also here to answer questions, so thank you for that. The last couple of days have been challenging. I think it's been challenging for those that have been ill with the disease and those family members, but it's also been challenging because of uncertainty. I think there has been a lot of that uncertainty since the Supreme Court decision on Wednesday, and I want to acknowledge that. Most of us struggle with uncertainty. Many of us just like to have things much more black and white than they are right now. This disease is uncertain. It's not a disease we can see often. And our path forward is uncertain in many ways because this is an unprecedented pandemic. What we do know is that there are basic public health principles that are true in any communicable disease, and we will continue to follow those. Again, thanks for joining us today as we share those things with you. Yesterday, we released a local order related to COVID-19. We know that there are lots of questions. Anytime something new happens, we know that that will be true. We've gotten a lot of phone calls. We know many people have gone to the website to look at the order. We hope people continue to read the order, review that order carefully, and when they have questions, to touch base with us to make sure that they understand it. What's clear right now is that this disease continues to be a threat. We were fortunate in some ways in this part of the state that the safer at home order meant that we had very little spread of disease initially. That happened because we kept our circle very, very small under that order. We know, and we've known, that as we make our circles bigger, that disease will spread. Our goal all along has been to make sure that that spread of disease happens slowly and progressively and does not overwhelm our public health or our healthcare system. We know that the virus will spread. We know that even in Eau Claire, when we're working hard to do this right, that we will have increased disease cases and deaths eventually. It's going to be hard on all of us when that happens. All of us, I know, are working hard to make sure that the impact is as minimal as possible in the way of being overwhelmed so we can't support the treatment of people that are desperately ill. All of us care about this. We need to work together, using the tools that we have in our toolbox to make sure we stop that spread. We'll spend time today walking through that order again. Yesterday it was brand new. We shared basically that it existed, and today we'll walk through a little bit more in detail. I'll first give the status updates that we always do. At the state level, we now have 1,028,657 negative tests. That's an increase of 6,059 negative tests. Positive tests are at 11,685. So 11,685 people have been tested and found to have COVID-19, an increase of 410. As you hear, that testing number for the state since we last reported increased from one day to the next at almost 6,500 tests done. Certainly a large improvement in the number of tests we're doing daily for COVID-19, one of our goals in responding to this disease. 1,977 individuals have been hospitalized at any point in time during after their test of COVID-19, and we now have 445 individuals that have died of COVID-19, an increase of 11 people. Again, a reminder that that's a big number of people, of Wisconsin family and friends that have died, and our thoughts go out to those people that are really facing those consequences of a disease that's significant. In Eau Claire, we have tested 3,589 individuals for COVID-19, an increase of 121 tests since Thursday. Negative tests are at 3,378. Positive tests are at 67, an increase of 2 since yesterday. 40 people have been released from isolation as of May 13th. The Sunday, Monday community testing event results are back completely now. We have 6 total positives of the 504 people tested. 2 of those were Eau Claire County residents. All the rest of the positives were from other counties. All of the people that were identified as positive from that testing have been called and isolated. So now about the order. So why do we think we have a problem that needs to be solved with the order? Just because the Safer at Home order is gone doesn't mean the virus is gone. Just because we've gotten to a certain date in the time clock doesn't mean the virus spread has stopped. The virus will not stop spreading until we either have a vaccine, which we know is many, many months out, or we get herd immunity, which will take a large amount of time to happen. Herd immunity happening, or those of us getting sick with a disease happening, needs to happen in a strategic and progressive way in order to not overwhelm our systems, in order for us to stay safe. So the problem in our community is a disease that we know we don't have natural immunity to. It is a disease that has caused significant illness and death across the world. And it will come to Eau Claire. We can't keep it out. It will be here in much more extensive nature than it is the minute we start interacting significantly more with each other. It's our responsibility at the health department and our statutory role to make sure that we are preventing this kind of a disease from having the impact it has had in countries where there hasn't been the kind of control taken to prevent the disease. Why should you care that we have this order? Why should you care about this disease? This is more than just about one person and whether they do the right thing or not. This is about our families, our schools, our neighborhoods, whether we have workers to work in our businesses. All of those things are impacted by this disease. There's a lot about this virus we don't know. I was sharing with someone earlier today that if this was a disease like measles that we didn't have a vaccine for, and you could see it, measles, you can clearly see when someone has measles, it would be much more easily taken care of. We do that work all the time in public health with our simple strategies of, we see you have measles, you now stay home and can't go out. Again, this disease is different. It is unusual and it's deadly, and we need to pay attention to it. We all should care about that because that's our community, the people that work here, the people that live here. We count on them in order to make things run smoothly in our community, and we need that to be able to happen. We also know that it's not just those that have significant health issues that are impacted by this disease. In this community, a large percentage of our population does have those significant health issues. That's one thing we should think about. And we also know that even for children, those that are seen as not that impacted, there have been found in the last couple of months some very significant impacts to children. The multisystem inflammatory syndrome, one of those syndromes that we're seeing in young children in other states where where COVID-19 started before it came to Wisconsin, are urgent issues that we need to care about. So what does this order ask you to do? It asks you very simply to follow proven public health principles that minimize the spread of disease. It says that businesses can be open and we can interact in society if those proven public health principles are adhered to. It tells you to stay home if you are sick, even mild symptoms, and it expects us to be doing all of those common sense things that are not written in an order, but are about washing hands, covering your cough, making sure that you are staying safe. We want people to continue to call the doctor if they need testing and make sure that they are tested. All of those things will make a difference long term. An order is only one of the things we are doing in this community, and in some ways is frankly the thing that we should do the least because we know people are going to be doing the right thing to prevent disease. It's what we want to spend the least amount of time on. We want to spend the most of our time on making sure people understand how to be safe and making sure that we are testing and controlling around the people that are ill. So what does the order specifically say in it? I'm going to walk through a couple of things, and then certainly there may be additional questions. The order encourages people to continue to minimize travel outside of the community. Again, this is not a requirement, but it is a strong encouragement. We have disease all over the state. When we leave our community, we have the chance of spreading disease, and we have the chance of getting the disease from others. So again, we're encouraging people to minimize travel. We are encouraging people to keep their circle small, to keep the number of people that they are in connection with to be small and be your household. The previous order, the state order, talked about that being a requirement unless you were doing essential work or being in an essential function. We are encouraging people to keep that practice. We are also encouraging people to consider in all situations having 6 feet distance apart. The strongest way we can prevent this disease from spreading is physical distance. I don't think you've heard me say that less than 100 times on these media casts, but it is critically important. Face coverings are only very partially able to prevent disease. What we can do to prevent disease is to have some distance between each other. If you do travel outside of the community and you can't maintain physical distance, we are in this order strongly encouraging you to stay home and quarantine for 14 days. That has been the recommendation from CDC and from the state from the start of this pandemic. We also are encouraging the elderly and those that are vulnerable to continue to take additional precautions. We really strongly encourage those individuals to make sure that they are keeping their circle as small as possible, not leaving home unless they have to. We also encourage, as we have all along in the order, hand washing, cleaning things, covering your cough and sneeze, not using handshakes, and other good basic public health hygiene. What the order does require, all of that list is on our website and in social media. So my ask of people before they start making assumptions about what is in and out of what we can do is that they read the order. We tried to do it in a simple way. It's a short order. We tried to do it in a way that people can digest. There might still be questions, and we understand that. If there are questions, we encourage people to call our call center number. The website where the order exists and where there will be available a Q&A document is covid19eauclair.org. The call center number is 715-831-7425. In a simple way, the order talks about minimizing physical contact, keeping the numbers of people in any given space small, making sure that there are policies to keep sick employees and sick customers not interacting and keeping them home, and a list of additional criteria that are listed out in Section 2 of the order. If businesses can meet all of those guidelines, they are able to open. In a very simple way, if you are able to meet the guidelines in Section 2, you are able to open. Different than the state order, where you had to be a certain kind of business in order to open. If you are not able to meet those guidelines, you currently, under the order, are not to be open. Mass gatherings, public and private, of more than 10 people are prohibited. If you are having a gathering, both public and private, that needs to be less than 10 people or less. As mentioned yesterday, religious services, public protests, other events, mass events that are protected by First Amendment rights are exempt, but they must follow all the health and safety requirements in Section 2 of the order in order to be operational. We'll continue to use data and best practices in making decisions about the next phase of the order. The end date of the order is not the end date of what we need to do in this community to move forward successfully. Similar to what the state has said in past orders, the end date of this current environment might be earlier than 2 weeks from now, if and when it makes sense to continue to look at measures that can be taken to keep risk low and manage the disease response. We needed to start somewhere, and this is the beginning. This isn't an indefinite order. As we review over time, we will certainly make everybody well aware of what the next steps are. This order also allows for creativity. If the requirements of the order can be met, you are allowed to open. It does not wholly say that any business, any space can't be open. It does say that you have to meet the basic risk requirements that are listed. While we're doing this ask of the community under this order, know that Incident Command continues to work on all of the other strategies that are critical in order to respond to this disease. This order is only one very small part, really, of what we're doing. An important part for all of us individually and as businesses to do. We also need to make sure that we have enough testing happening, that people that are ill call their providers and go in to get a test. Every symptomatic individual in Eau Claire County needs to be tested. They also need to stay home from work and other tasks that they want to do to make sure that they're not spreading disease. We continue to hear from people that test positive that they have been out in the community and they think they're not that sick and it's not a big deal to be out. When they get tested, they realize what a big deal it is when they become positive. So please make sure that if you have any symptoms, you stay home, you call your provider, and you get tested. We are also working hard on our personal protective equipment supply for all of our responders and healthcare workers. It's critically important that those people that are required to be closer than 6 feet have the protection that they need. The only thing that is protective in those situations is the right kind of PPE, and we need, as a community, to have that for them. We continue to work on that PPE supply. And we are building our contact tracing pool and responding to all positives and going out and making sure that we are in contact with all those that are contacted and making them stay home. We do that now with our existing 60 people that are, more than 60 people that are positive, and we will continue to do that as the numbers climb. There are lots of pieces in place for this. We know that we have a lot of work ahead of us as well. Again, this order is only one piece of the whole. So again, make sure that businesses that are paying attention to the order, all of you need to do that in Eau Claire County, that you are reviewing carefully what's in there, walking through the list of requirements that is listed, and they are fairly straightforward. If there are questions, ask questions. We've developed a simple handout that is available on our website that walks through each of those requirements for businesses. And it's basically a checklist. If you can meet all of those requirements, you are able to be open. Again, we're asking people to go to the COVID-19 Eau Claire website to get information. We are responding to questions as quickly as we can. Our call volume has obviously been high, and we understand that. We want people to have the right information. But our ask is for you to first read the order and then to make a phone call if it's still not clear. Please stay tuned on our website and on our social media site. That's where we continue to provide updates as things change. We will add additional information with frequently asked questions. We are getting many related to certain sectors, and we are getting those out. The Chippewa Valley Economic Recovery Task Force is also a point for information about how to look at the order. It's also a place where you can provide input in on the questions and concerns you have as a sector. So that's another point of opportunity as those sectors get going, to talk to the leadership of each of those sectors as things roll out. We appreciate your time today. We know it's precious for many of us in this time of responding to COVID-19. We want you to have the right information, and we will continue on Monday, Wednesday, and Friday doing these media events. My ask of you today, and really the most important thing we ask of you, is to stay home if you're sick. We continue to see this as an issue. We want to make sure that we protect people from this disease. Many people don't know that they're spreading the disease. They are asymptomatic. But for those that do have symptoms, we need to count on you to not spread the disease. So I am available for questions, and then we will close out. Thank you. Yes?
Lisa, WBAY TV was reporting this afternoon that Brown and Manitowoc counties, after initially issuing similar orders, are now rescinding those orders. The Brown County Public Health Officer was saying that after further review, the county's attorney decided the local health order may not stand up to a legal challenge. Interesting if you care to comment as it relates to Eau Claire's order.
Certainly. So the question is related to orders that have happened at local levels around the state in the last 2 days. Some of those orders, decisions have been made recently to rescind those orders. And the question is related to what is the status of the Eau Claire order in relationship to the comments made about those orders. Eau Claire did put together a very different order than most areas of the state did. Our order did not utilize the language directly from the Safer at Home order that was utilized by the state. Eau Claire made the determination with legal counsel to walk through an order that was risk-based, that was based on the risk that we have with this disease, and to order things related to the ability to mediate that risk. If there is an ability to not, to make sure that those things are in place that are in the order, especially under number 2, then any business can be open. It is not a business-specific order. There is also clear indication in the order that we are following that risk in order to move forward. Other orders were mirror images of the state order, which was not found by our Supreme Court to be possible in this state. And so some locations, and certainly talking with them directly about their reasons, found it difficult to keep the order as written. Yes.
Along those same lines then, but a little different and closer to home, Chippewa County Health Director Angie Weideman, your friend who we've seen here a number of times, announcing this morning that they were not going forward with an order, saying they did look at writing one, but determined they do not have the authority to enforce it. So again, just similar, but just wondered if you had any comments.
Yeah, so the question was about neighboring counties and the comments made about the ability to enforce a local order. There is an Attorney General opinion coming out actually as we speak. I assume it will be here shortly if it's not already, about the enforceability of an order. That is a question that many local health departments are looking at right now, and legal counsel is looking at right now. A reminder to everybody that the statute that this is cited under, both our order as is every order across the state, is a state statute that has been in existence for a very long time. The enforceability of the order is a separate question related to the ability of having local ordinances in order to cite under the order. We are able to have an order. We are able to control communicable disease at a local level. Again, with a disease that is worldwide, doing this as a patchwork quilt at the local level is not the best practice. It is certainly not what any local health department wants to do, and certainly not likely what any legal counsel would prefer. Enforceability is a separate issue than whether or not an order is possible. Our order, we believe, is enforceable, written the way we have it, and again, it's very dependent on the content of the order and the ability at a local level to enforce. Yes?
Somewhat along those same lines, there's businesses within the city of Eau Claire, but they technically fall in Chippewa County. Mm-hmm. So since Eau Claire County and Chippewa County, they kind of have different wording in what they're doing, would those businesses fall under the city of Eau Claire guidelines, or would they fall under Chippewa County guidelines?
Sure. So the question is related to kind of an interesting thing that we have in this community where City of Eau Claire residents, that area of, there's a small part of our county that the City of Eau Claire is in Chippewa County, and the question is about whether the order stands true in that area or not. We will have to get legal opinion about that. That's a very small part of our county. Again, I want to repeat that our goal with this order is to never have to enforce it. Our goal with this order is that we've put forward clear guidance about what is expected and needed in this community. I know, and I've heard over and over and over again from people that are counting on our businesses following this order so that they as customers can go and feel safe. I've heard from countless employees that are counting on businesses to do this in order for them to be safe. And I expect that most of our businesses will follow that. So again, while it would be best to have a statewide order, and the differences in this specific circumstance between Chippewa and Eau Claire for those Eau Claire County, those City of Eau Claire residents may be a concern. In the end, the public health principles are true across our state. Our ask for everybody in the state is to follow these basic public health principles. Here we have an order, and we are educating, utilizing that order. Yeah.
Going back a little bit to the public testing that you guys had done earlier in the week, when you asked the National Guard to come in, you kind of had an idea of a lot of people in a couple days, hoping to get kind of a snapshot of what the scenario looks like in Eau Claire. Now that those numbers are in, do you feel like you got the answer that you were looking for with it? Do you think you got some useful information from those 2 days?
Yeah, so the question is related to, did we get the kind of information we were hoping to from our 2-day National Guard testing that happened, the more than 500 tests that were done on Sunday and Monday? Part of the reason that we did that was to really get a snapshot in time of where disease is in the general public, in the community for those that have very low level symptoms. And we haven't run all the data yet to really get a good idea of what that population distribution was. So it's a sample of our population, but I would say not a random sample of our population. From that, we had very little disease, which is a good thing in our community. It gives us a baseline. I think it tells us in some ways that Safer at Home has worked for that general public. Certainly, many of the people that came through had very generalized symptoms, ones that, frankly, as we were screening them, we weren't hugely concerned about. But it also gives us an idea of basic, even nearly asymptomatic community spread. My goal is that we have this happen again, and we see in 4 weeks or 6 weeks where that is. And we'll see if we're able to do that. That National Guard asset is one that we have to request, and it is being requested broadly across the state. But I think having these types of events gives us a really good snapshot in time for where we're at. And it does help tell the story of how disease is progressing. Again, not significant that the numbers were low right now, because we know the numbers will be high at some point if we don't do the control measures that we need to do. But it does give us a starting point. And I think an example of a community on the western side of the state where the prevalence of disease is a bit lower is part of what we expected in many ways. The disease, I said to someone last night that if the disease would have spread from Minneapolis west instead of probably more like Chicago east, We might have had a lot of disease in March, different than what we had now. Disease spread primarily into Milwaukee-Madison area, and it's part of the disease path that we're looking at. So we're expecting more disease. This was a snapshot to give us a starting point, I believe. Yeah.
A little different topic. You mentioned the PPE a couple of times. I know that's been an issue before, and it sounded like it had gotten significantly better here and elsewhere across the state. Can you tell me a little bit more about where it's at right now, and what does the process, is it still you guys working with the federal government and with the state to try and get more PPE?
Sure. So the question really is about PPE and the supply of PPE. How is that working, and how is it looking for PPE supply across the state and locally? Personal protective equipment has become a topic that probably many people that never even heard the abbreviation PPE before now are talking about PPE regularly. We have a complicated distribution system, and we have an ever increasingly complicated need for PPE in this situation. So for those people that are in very close physical contact with anybody, the recommendation is to have protective equipment that makes sure that the disease is not spread either from the person in a healthcare setting, for example, that is giving the care, or from the person that is receiving the care. The supply lines of that very specific type of mask, for example, are still catching up. Those supply lines, we're supplying a need that is entirely different worldwide than what we have right now. So the federal government is working on that. The state government is working on that. So the state is working directly with suppliers locally within Wisconsin to increase supply. The federal government is doing the same. And at a local level, we're also doing that work to talk to local suppliers about increasing their supply chains to meet local needs. So it's happening at all three levels. I will tell you that the personal protective equipment is not sufficient to meet the need as we reopen. So some small examples, not small examples, but as we have increased healthcare happening beyond emergency healthcare, those workers, because of this disease, will need increased PPE. We know already that those close contacts, if you think about when you went to the doctor a year ago, they weren't wearing a mask even if they got close to you in an exam. Certainly now, they likely will be wearing a surgical mask, a very different amount of PPE that's needed. The same with dentist office. The same, you name the setting, those settings all have a higher need for PPE for those close contacts. Because of that, we know there are shortages in certain sectors. We are prioritizing sectors in Eau Claire for those and across the state. It's not just us, but the supply chain that we get from the state and any supply that's donated to us, we do have a priority order on who gets that supply. Healthcare workers, emergency responders, long-term care facilities are certainly the top of our list as the places that will get supply when we receive it. Many places that need PPE are doing their own work to get supply as well. Sometimes successfully, sometimes less successfully, and we know that that is true. We need to keep working on it. Yes?
If we could come back to the order, I think it's important, so I just want to clarify, just to recap, as I understand, that when you cited Brown and Manitowoc counties, among others, that rescinding, and you indicated it sounds like there's no intention or plan to rescind the Eau Claire order. Second, you talked about word we can expect from the Attorney General to talk about the legal support to do an order. So I'm just curious, some are saying that this is just, the Eau Claire order has been summarized as kind of some well-meaning and suggestions. And so can you please explain why the order in Eau Claire is not a paper tiger, why it is more than just guidelines, and how if people don't step up to it, what and I know you've said yesterday and today you'd like to not have citations issued, but I guess could you please speak to the fact that it's got some bite?
So the question is related to, again, enforceability of our local order. There were a number of pieces to that question, and I'll try and address them all, but certainly you can have follow-up if you'd like. Attorney General Call's communication, I believe he met with us as local health department directors at 2 o'clock before I came upstairs. My understanding of his opinion will include that it is enforceable under citation, so it's not again, to clarify, and earlier in the COVID-19 event, there were examples across the state, not in Eau Claire, where people were arrested for violations of the order. That is not the case for our order. These are citation authorities. A fine would be given for the challenging of an order. So again, just to be clear about the type of teeth, the ask was about the teeth of this order, it is citation authority. Our goal is education, having people leave if they are in a situation that is not meeting the order. The order is a requirement, it's not recommendations, and the process will be, and we've worked hard with law enforcement on the process, and I may as well walk through that with everybody so that you have clarity about it. The process is, if we get a complaint, law enforcement will respond. If it's during the day, a health department official may respond, but we have the capability of law enforcement to respond. Law enforcement will go in if it's a facility. I'll use a restaurant as an example, although we know there are all kinds of facilities that may have questions. The law enforcement officer will talk to the people there, will indicate if they review the order and they are in clear violation of the order. They will talk to the people there, they will indicate that they are in violation, and they will ask them to stop whatever practice it is that is in violation. They will document that violation. That documentation will be brought to the health department for review. It will be brought to the DA for review. The citation will not be issued on site by the police department, and that's a typical process for all health department citations. Typically, the health department issues those. So again, it's not different than our other processes. It's the teeth in it is a citation. And very frankly, our job is to make sure that citations don't happen. Our job is to make sure that people understand the problem. And our job is to make sure that for the short period of time, hopefully, that we continue to have orders like this in place, that people change and follow the order.
Thank you very much.
Yes.
There was a well-known bar incident last night in the Chippewa Valley at least, and I'm not sure how many bars are open, but you did talk about 10 people. So I guess a couple of parts. Are you aware of how many bars, as we head into this weekend, are open?
Sure. So the question is related to bars being open. Any bar can be open that follows all the criteria under number 2. It is not related to the mass gathering, the 10 or fewer people. It's related, which is number 3 in the order. It's related to number 2 in the order. If a bar can meet all of the criteria under number 2, they're allowed to be open. If they are not able to meet the criteria under number 2, they are not allowed to be open. I frankly, as part of the question asked of, am I aware of bars being open? I am not. I certainly have not had time to follow that, but others may be aware of it, and we are strongly encouraging people to not go to bars where they're not meeting the requirements. It's not safe for you to do that. And certainly, if there are complaints, to please follow up by calling our COVID hotline. And very frankly, I've talked to many owners of establishments that are doing the right thing. They have questions about how to do it right. They're working through making sure they're doing it right. And we are really pleased in Eau Claire that that has been a primary focus. We hope that continues. We know it's difficult. That is not one of the challenges with places where the usual circumstances being in close physical contact, that's what we go to some of those places for. That's the problem right now in spread of disease. And so we are seeing that across the world in places like nightclubs and bars where there are challenges. Again, if it's possible to meet the requirements of the order, that any establishment can be open.
I have a couple more. A listener to our Facebook Live saying, what we see so far is tons of boats and campers heading north in addition to customers relaxing safe practices at stores. She writes, Cindy says, wait for it, as 1 to 3 weeks will show how much increase or surge we will see. Just wondered if you'd comment on that.
So, reporter is sharing a comment on Facebook related to people not following physical distancing requirements in stores, going to their cabins or heading up north, various other practices that are concerning. Certainly, there are no specific prohibitions from traveling for any reason. Our recommendation is that people stay safe in that travel. Our encouragement is that people stay closer to home. We are also mandating the physical distance requirements in stores, so that is something in the order that can be looked at. And the question really is, what are we thinking will happen if we have people that don't follow the order and don't follow the basic public health principles? In the end, it's not about the order, it's about following basic public health practices to prevent the spread of disease, something that we all should want to do. If we don't do that, we will see disease. The way we will see that is really too late for us to think twice about, oh, I shouldn't have done that practice. I shouldn't have gone to the bar with all of those people, because spread will have happened. That's part of why an order is important. We will be tracking the spread of disease. We have data points that we are looking carefully at to see the implications of this change, which is an opening of the previous Safer at Home statewide order. And we'll be watching that over time to see what happens next, as will the state as a whole.
A listener contacted our radio station and asked me to ask you, could you please have the bathrooms opened at the city parks?
Yeah, so a specific question about bathrooms at city parks. We know that there are bathrooms available that are porta potties, and those with cleaning are available and open. Bathrooms that are group settings are currently not open because the city is not able to maintain all of the requirements in the order that are there in those public restrooms. I know that we will continue to have those conversations, and we know that that is important service, but we're asking people now, because we don't want disease to spread in those environments where the clear criteria cannot be met, to find other ways to make sure that they have those needs met.
I know I'm giving you a workout here.
Yep.
This is another listener saying that I please ask you if his words are you threatening professional licenses for failure to comply to the Eau Claire order? Meaning, again, in his words, the barber opens up, are they being threatened to lose their license? And where in the ordinance does it allow them to do so?
So the question is related to other licenses that a business operator may have, and is there a threat in the order about that? There is no specific language in the order that is related to any other additional provision for a license. And it is important for any license holder to understand that if a license criteria includes following an order, it may be considered during that time. So our order does not speak to any other license, and any license may be subject to consideration of not following an order and having that documented. So I think we'll wrap up now. This has been a long media session, and I know people listening are appreciating the content and appreciating the feedback. Please go to the COVID-19 website. We encourage you to do that to get good information. We will be regularly updating that with more information. We, like you, know that having good information on this order and on the disease is critically important, so we're committed to doing that work. We have an amazing team that I need to thank more than I do that works on our social media, that works on getting our information out in a clear and specific way. So some of those people are in this room and they deserve an enormous thanks. Communication is a tough challenge, and you as reporters are doing that, as well as our team here. So thank you for the work that you do to get good, clear, and correct information out. The website, covid19eauclair.org. The call center, 715-831-7425. My hope is that everybody has a good weekend, that you find some time to rest and enjoy outside. I am hoping that we get a couple of hours of good outside weather, and we'll be back on Monday.